We're talking about a digital health app called Byon 8, and having this conversation with me is Mandela Kibiriti. Welcome to the show.
Thank you for having me.
And you are branded.
Yes, fully.
fully branded. Welcome to the show. Maybe you can
me.
start with introductions, what it is that you do with Byon 8 before we even get to what Byon 8 is.
Yeah, sure. Thank you, Mikali, for inviting me to the show.
Carry with
So I'm a medical doctor, and I work at Byon 8 as the Diagnostic Performance Manager. It's a fancy title. So short is DPM.
Okay.
I work predominantly on the medical engine, which is a symptom checker on the app. And I also work currently with medical partnerships within the app and how to create this ecosystem where patients can get this end-to-end experience.
Okay, I think we've already got into the app. Let's just go there.
So Byon 8 was founded in 2014, originally from Sweden, born in Sweden, but growing up here in Kenya.
Okay.
We have two service offerings. One is the symptom checker that I mentioned, which is where when a patient comes into the app, they can put in the symptoms, and then the app will then tell them what is the most likely differential diagnosis that's causing these kinds of symptoms. And then the second thing is obviously the consultation services, where you can talk to a doctor, and we have a team of 21 doctors, some of which are general practitioners, others are specialists. Okay. And the consultation service is either text-based, where you can actually text a patient, a doctor on the app,
okay.
And the other is a video consultation as well.
There's video consultation?
Yeah.
So we download this for free?
Yeah, it's for free.
It's free. Yeah. So we look out for Byon 8.
Yes.
When I get in there, definitely I log in. You know, what my name's age and everything that needs for me to register and be a part of this.
Yeah.
So this app helps me get help at whatever place I am?
Anywhere, anytime. We've been fortunate to have a large user base. We're actually the leading digital health app in the country.
Wow.
Following NHIF.
I have to say, you guys are very big on YouTube. Like every time you want to watch a different video, but then what happens?
Byon 8 is there. And this just goes to show that we are there for you anytime, anywhere. Yes. We have over 20,000 monthly active users on the symptom checker alone. Whoa. We've had 200,000 downloads of the app, and all these are numbers within Kenya alone. Wow. And we are currently just focusing on the Kenyan market. And we've offered over 800 consultations on the app with the team of doctors that we have on the app.
How many doctors did you say?
21.
21 doctors who are constantly there, whatever time I need. It does not...
Yeah.
I'm lally. And it's not automated, because some people will be like, how will they know? How will they know? Is it automated? Do I get to talk to a doctor? But instead, you can get a text, you can text them, and you can do a video consultation.
Yeah.
And do I pay for all of this? Because it's good.
Yeah.
It's good, but then again, what's the cost implication?
So we offer for the general practitioners, we offer the consultation services depending on whether it's text or video, from 395 shillings all the way to 895. So it's under 1,000 shillings, which is cheaper than any other facility that you go to. Yes. And at the end of the day, you do get to see a qualified doctor on the app. And then for the specialists, it's 3,000 shillings, 2,995 shillings. And the reason why we price it lower than anyone else is because we want to ensure that there's a level of accessibility. And sometimes access is a question of cost. But the other thing also is why we're so big on the partnerships is we want to have insurances cater to this so that you don't necessarily have to pay out of pocket. And then the other thing is also working with the other partners, the other labs, pharmacies, is that the cost of care comes down. And think about it this way.
Yes.
If I'm unwell and I need to rush to hospital, I need to pay for the transport to get to the facility.
Yes.
There's the time it takes to see the doctor. And at most times you'd find that you don't necessarily need to see the doctor physically. You can actually just see them on the phone and they can give you the recommendations. And to create this kind of convenience, the partnerships that we are working with, like Kasha, which is a digital pharmacy, and Ilara Health, if you need labs or if you need drugs, this can be done within the partnerships that we have. So if we write a prescription on the app, Kasha can then deliver the drugs to where you are. If you need lab tests, Ilara Health has a large network, and you can go to them and then the results are sent to us. And then we can give the recommendations all within the app. So you have this end-to-end experience where you see the doctor, get the drugs, get the tests, and it's from the comfort of your home.
That is so dope. So personally, I do not like hospitals. I think it's something about the smell. I think it's something about the smell. And having this for me, then that would definitely mean so much more, that I can get help. And sometimes you don't go to hospital because unasema, it's just a headache. Or it's just, or maybe it's just I'll be okay. But then with about 395 bob, or less than 500 bob, then I'm able to just find out what could be wrong with me.
Exactly.
And I could get help.
Exactly.
Because sometimes it's not that you don't want to go to hospital, it's just the procedure of, okay, now I need to go.
Exactly.
Then I need to pay for consultation. Then I need to wait. And then I'll be sent to the lab. And then I need to wait again. So that is all taken away.
All taken away with the convenience of the app. And then the other thing is we're trying to battle two things, cyberchondria and self-medication. So cyberchondria is where you're unwell, and big terms. I know.
I'm like, okay.
But you're unwell, and then the first thing you go to is Google or WebMD. And then you just check, okay, this is what I have. It's a headache, or then I have brain cancer. And that's the first thing that you usually do.
Google is the worst.
And rightfully so. And then the other thing is self-medication, where you go to your nearest pharmacy and you say, I have a headache. What's the best thing that you can give me for that?
Okay.
And usually what we're trying to do is first get the right information of what you need. And that's why we are trying to create this base of primary care, because there is no really well established form of primary care within the segment that we are serving. And it's always good that if you can have that care provided for closest to you, and that's through your mobile phone. We have a crazy high mobile phone penetration rate. And just like the last line electrification program, why can't we bring the doctor closest to where the people are? And mobile phones can do that for us. So the app is there for you, the doctors are there for you, the ecosystem that we're trying to build and building currently is there for you as well. So you can have your healthcare, and we can make Byon it your healthmate.
Okay. Ooh, just say that again.
Byon it your healthmate.
So I'm gonna throw, you know,
Yeah.
What if I don't have a phone? Or probably I used to have a smartphone and something happened. Now I have a kabambe. So I don't have all these bougie apps in there. Is there a way for me to get help with my kabambe? Or probably I don't even have internet. Ninaishi bundus.
Moko mashinani, understandably. So we are in conversations with several telcos to have, one, for those with smartphones, zero rated data. That's something we're still trying to...
That would be dope.
That would be dope, especially for healthcare. If it can happen for Facebook, healthcare is necessary. And then also try to see how we can use USSD and voice consultations. But the other thing that we're trying to push is, especially with the partnerships, is that fortunately, as of now, we have at least several clinics that have a national outreach. And we're in conversations with those kinds of clinics where we can have virtual digital clinic days within those clinics. So you can have a tablet there, and the patient literally goes there to see a specialist or a doctor for where they couldn't see one before. And that's the kind of thing that we're trying to do right now.
I think that's really nice. And does it matter what my condition is? Are there some conditions that you will definitely be like, we do not have that here, or do you have doctors that handle everything?
So currently we have, as I mentioned, the general practitioners, and then for the specialists we have pediatricians, obstetricians and gynecologists, dermatology, internal medicine, psychiatry, and we also have psychologists as well, because those are the main cadres of people that patients really want to see at the get-go. We are also trying to have other networks and partnerships with other people. So like, for example, emergency evac with ambulance services, that's something we're trying to cater to, from things to do with nutrition as well. And you just had Shazmin on the show. I mean, that kind of thing where you have this wholesome, holistic, and also very end-to-end experience. Those are the things that we're working on currently. And you can access the doctors anytime, anywhere.
Question. I've been asking so many.
No worries.
But say I have a condition that probably I talked to Dr. Mandela, and now Dr. Mandela is not available. Is Dr. Mukali able to, get to know what my history is? So not every time I do not start from the beginning again. So are my files, my health journey also, and is it protected?
Yes. Thank you for the question. So we have what we call a consultation summary on the app.
Okay.
So every consultation that you have with the doctor documents what the consultation was about, and the presumptive diagnosis and the recommendations they gave.
Okay.
And that consultation summary is within the app. So if anyone has a Byon app, there's a section called My History. It stores everything from what you checked when you're using the symptom checker to the consultations that you had and with which doctor, even the prescriptions as well. And any doctor that you have, you saw me first and then somebody saw Dr. Mwikali. Dr. Mwikali will see the same information when they have another consultation with the same patient. So that patient journey is always there. And I can understand the frustration with patients where you spoke to one doctor and you then have to go again, say the same things over and over again. But that's now taken away and that's solved within the app where the history is stored within the app. And because the app was originally founded in Sweden, we follow the GDPR data protection standards.
Okay.
So all the data that's stored within the app is anonymized and pseudo-anonymized so that anyone that sees or has access to that data is only the doctor who's providing the consultation and the patient who's seeking that kind of consultation.
Okay. Yeah. So we can't be going on the app and be like, so if Dr. Mandela is not in, I'm not talking to anyone.
Yeah, but we have a wide breadth of doctors who are qualified, who can provide the same kinds of consultations.
And your information is there, so you don't have to start all over again.
Exactly.
And I love the fact that it's under 1,000 bob. For everyone out there that is, and by the time in Africa, 1,000 bob, it must be really
serious.
And insurance.
So we are in conversations with some insurance companies to have this catered to. It's it's a work in progress. But with the usership that we have, I mean, it's only about to happen sooner rather than later. And
we're looking forward to all of that. I hope it happens. So details again of where people can find this and. Sidhani kama kuna details zingine. If anybody wants to inquire and people want to be a partner or they want to bring in their pharmacy into the app or they're a doctor and they want to just be on the app, how can they go about that?
Great. So we have two apps, the patient app and the doctor's app. So the doctor's app is Byon Pro. So all you need to do is send an email on byon.pro@byon.com. And then we'll see it.
Okay. Yeah. So if you're a doctor, I got you. Got you. Get in there. Asante sana.
Thank you so much for your time.
So Byon 8, Byon 8.
Yeah.
That's the app we are downloading today. Let's take care of our health. What did you say, Byon 8?
Your health mate.
Your health mate. Yes, you got it. Thank you so much. We're going to take a very short commercial break. We'll be right back. Don't go too far.